Well, thank you very much, and good morning, everyone. It's absolute pleasure and honor to be here. My name is Dr. Olha. Originally, I'm from Ukraine. At the age of 25, I moved to United Kingdom, where I live and practicing today. My background, I'm a dental surgeon, and I'm fully specializing in aesthetic and anti-aging medicine. I'm a proud owner of 2 medical aesthetic practices and a big part of our clinical work promoting wellness and positive health and healthy lifestyle to our patients. In the next 11 minutes now, we're going to explore the most common factors that actually influence weight gain in modern society. I have no financial or conflict of interest disclosure to make today with regards to my presentation. So BMI is a widely used, most used index that correlates potential health risk to our weight. The interesting fact that it has been invented by scientists, but not a medical scientist, by a mathematician in 1930, and it has been widely welcomed by life insurance companies that help them to identify potential customers who are at high risk. Today in the world, we are facing an epidemic of obesity. Despite of increase and advancement in all the technologies, improvement in medical sector, increase of life expectancy, for some reason, overweight people and obese people growing rapidly. Over the last 50 years, the number of overweight people in the world have doubled. And historically, it has been a problem of Western culture. A lot was blamed on American fast food, but today we see these trends have changed. And we see a high number of overweight and obese people in developed world, in countries with a high percentage of population malnourished and underfed. We see that this problem no longer affects only adults, but it's a huge problem in growing population, in young children. And as a result, a lot of young children develop conditions like type 2 diabetes, which hasn't been a problem in the past. So what is the most common causes? Of course, it's a multifactorial problem. And it is scientifically undisputable that hormonal imbalance as well as hormonal changes and genetics play a huge role. But we as a human species has been inhabited this planet for 2.5 million years. However, over the obesity and weight gain became a problem only over the last around 50, 60 years. So we couldn't change our genetic within such short period of time. So there are a lot of external factors that contribute to how our body function. And that is a lifestyle, a stress, medications that we're taking, poor dietary choices, and not just overeating, but what type of food we eat. So with development of agriculture, we have been introduced to refined carbohydrates over the last 1,200 years, but it's only in the middle of 19th century this became a big part of our diet. As a result, overweight and obesity has a negative impact on our health. So most people who carry excessive weight more likely to develop multiple medical conditions like cardiovascular problems, respiratory problems, kidney disease, diabetes, as well as the multiple forms of cancer. Some might argue and say that it is a simple equation: eat less and exercise more. However, this formula will not be effective for every single person. There is much more complex factors that we need to take in consideration. Over the last couple hundred years, we changed our lifestyle. From hunter-gatherers, we became, as a society, a couch potatoes. So we live sedentary lifestyle. We sit in front of the screen, we drive to work, and often when we're presented with some choices where we can be a little bit more active, for example, taking a staircase over the elevator, some of us unfortunately prefer to take an easy option. The types of work that we do today is also have underwent dramatic transformation. from moderate metabolic expenditure work, where required to use a lot of energy. These types of work have decreased, and jobs with light metabolic expenditure are on the rise. And also, let's have a think, how many hours do we spend working? A lot of employees are very busy and work outside of working hours to finish their project before the deadline, to meet their targets, and that is a list of the countries where a lot of employees work longer than 50 hours per week. And this leaves us with very little free time of outside of work for other activities. And when we presented with the leisure time to do things that we like, according to American Time Use Survey, a lot of people spend this time in front of the screen as well as playing video games. During preparation for today's presentation, I came across a wonderful piece of information. I think it's exceptional educational channel by Dr. Mike Evans. And one of his videos that I watched called 23 and a half hours. It answers a question which I believe all of us should ask ourselves. What one of the most important thing I can do to improve my health? And the explanation in this video is scientifically based, and the answer is do 30 minutes of physical activity a day. So this picture has been taken at the petrol station in United Kingdom, and this is a food choices, ultra-processed foods that we are presented and surrounded everywhere we go today. It's not just that, the times that we're spending working long hours and living a busy lifestyle take away from us probably one of the most important factors, and that is cook fresh meals for ourselves. But multiple billion food industry have made already this decision for us in the form of a meal deal. So this is a type of food that often we will grab on the go and eat in front of the desk while we continue to commit to our lifestyle or work. And also the way where we buy our food have changed dramatically. Majority of us buy food in the supermarket because it is a convenient one-stop shop. You can buy everything there for your weekly shopping. And sadly, that is the place where we presented with the most amount of ultra-processed food. Multi-billion food companies created highly palatable food for us, and we as humans are creatures of habits, and often those habits build through the lifetime, and food is one of those habits that we kind of build through our childhood. So this is the 11 most large food manufacturers who present us with the different choices. It's very small print on this slide, but unfortunately nothing that is there has been growing in the garden, or it's all heavily processed food. And I think the sad reality of today as well is that often the choices that we make and our patient makes, they're not always based on genuine choice, it's on the choice that what you can afford. And the sad reality is that sometimes buying ultra-processed food becomes more affordable and appealing than buying freshly cooked or freshly grown fruits or vegetables. And also the labeling on the food market today could be quite confusing. In our practice, we do ask patients to fill a diet chart where we help them to analyze the food that they eat and where there is a hidden source of refined carbohydrates or sugar coming in their diet. And often we would be able to identify between 10 to 15 sources of hidden sugar. In fact, there are 75 different names for sugar if we have a look at the labeling. Obesity as well as overweight cause a huge burden on healthcare system, and despite different countries constantly increase investment in healthcare sector per head of population, we don't see the following trend in the life expectancy as well as the life quality. And also we need to be very mindful of the societies that we're living today. I think there is a big impact social media and media makes, and it has a lot of positive factors with that. So that is a great representation of diverse, inclusive society today. And on the other hand, we have the same media has a negative influence. It put to us a body image that not always will be seen as healthy, and for many people it would be unrealistic and unachievable. So this is a fashion model from 1990s, and back then a lot of young children and specifically girls have been influenced by unachievable body image, which resulted in multiple eating disorders. Today, the same media companies present to us a body image that promoted as a healthy option, but potentially could be dangerous to the health. Influencers play a huge role in our life and in the life of young adults. And these are 4 TikTok influencers. So they have been a part of the movement who promoted that obesity is absolutely healthy lifestyle. And I honestly respect everyone who is able to accept their body image and feel comfortable about themselves. That is, I believe, very great thing to do. But promote something which is potentially could be dangerous and lethal to a million people who implicitly trust you possibly can be wrong. The tragic reality is that all of those 4 people have died before the age of 45. In medicine, we are having a responsibility and duty of care to our patients. And what should we do in today's society? Should we just stand by and see how population getting unhealthier, making the wrong choices, or are we able to implement any change? I believe that in our professional as well as personal life, we should be leading our patient not only by advice, by example as well. I grew up in Ukraine, in my grandfather's farm. There was no social media, and in all honesty, I even didn't have a TV. And I believe that as a person who influenced my healthy life choices, and to whom I'm grateful that I have been able to maintain the stable weight through my entire life, despite having 2 pregnancies. And medical aesthetic practice, I believe through the consultation and the right recommendation, we're able to influence our patient to make the right style choices and follow the healthier lifestyle. Thank you very much.